In fact, the rate at which lawsuits against hospitals is increasing in Ghana is alarming. I would say it's partly because most clients are becoming more and more aware of their rights as patients, and most relatives are also becoming aware of their rights as patients' relatives. There is therefore the need for sensitizing health workers in order to avoid lawsuits. Lawsuits are so expensive. Imagine a hospital is struggling to raise about 1.3 million Ghana cedis to buy an ambulance, and then a client drags the hospital to court, and at the end of the day, the client is awarded 1.4 million Ghana cedis. Imagine, first of all, it won't be easy for a district hospital to raise this amount. And number two, at the end of the day, the hospital will still not get the ambulance. Now, patients that will need the referral, what happens to them? Some will die and complications. So you can see the chain of reaction that is going to happen from one single lawsuit. This presentation covers definition of law, classification and health law, definition of terms, departments that are risk for lawsuits and some of the causes of lawsuits, the rights of patient, duty of care and breach of duty of care, malpractice and negligence in the case of 37 Military Hospital versus late Helena Brema Nyamiche's family, leading to over 1 million Ghana cedis against 37 Military Hospital, and finally measures to avoid lawsuits. Now, laws are a set of rules and regulations that are laid down in a society and are enforced by authorities. So when you come to the health sector, we have rules and regulations that are laid down. So at the end of the day, we have authorities who enforce this. So every institution, we have people in leadership, people in authority, and they have this power to enforce the law. So it could be your in charge administrator, medical director, or your supervisor in your hospital. Now, when these laws are laid down to be used in running the affairs of an institution, and this institution is a health facility or has something to do with health, that is health law. Now, plaintiff and defendant. Plaintiff is the one who sends the case to court. Just being practical. The one who sends the case to court is actually the plaintiff. He sends the complaint there. And the one who goes to respond to this complaint of the other person becomes the defendant. So, for instance, if it is a lawsuit against a hospital, the client who sent the case to court is the plaintiff, and then the hospital going to respond it becomes the defendant. You are defending yourself. Then non-malfeasance. It is a principle which tells us to avoid harm to our patient. Under no circumstance should your action harm or hurt your patient. We have confidentiality. It's about keeping the data or information of your patient so secret. Data protection and privacy is the core thing here. You should not leak their information, nothing. Okay. Autonomy actually has to do with personal freedom and self-determination. It is made up of 4 basic things. One of them is self-determination. The patient should be able to determine liberty, independence, and agency, which will be explained in subsequent presentations. Okay. Now we have informed consent and consent. Mostly you ask patient that doctor want to go and conduct CS to remove your baby because your baby is big. Will you agree or not? Then they say yes. Please, what you have just done is consent. You did not inform. Informed consent is the legal principle. Don't consent only. Such procedure, we do not consent. There are things you ask yes or no. But informed consent is actually different from consent. So when you say consent has been granted, on a patient that is going for laparotomy, and you are saying consent has been granted, if you put this in your notes, one day you'll find yourself in sweating under air condition, please. So please, informed consent has to do with explaining the positive aspect and the negative aspect of the procedure. The alternatives is the patient wants, and the disadvantage and advantages of even the alternative. The disadvantage of the patient even refusing the first option you gave. In this case, You have to give a fair balance between being an advisor and a counselor. Very necessary. Having explained all these things to the patient in a language that this patient understands so much, the patient will determine. That is autonomy, self-determination, freedom to determine. They have that liberty to determine what they want. Very important. Explain everything in a language that the patient understands. And before you even get an interpreter to help you, make sure that the patient wants this interpreter to hear his or her problems. Also consider patient's confidentiality when you are looking for an interpreter. Thank you. Veracity. You must at all times tell the truth. Our culture, sometimes when you tell patients the truth about the state of their health, they do not want. But we find ourselves in a profession that mandates us to tell them the truth at all times. Okay. Fidelity. Keeping one's promises or commitments. Once you tell this patient that at 12 noon, I'll be coming to check your vital signs and serve your medication, and you do not do that, and they keep reminding you all the time that a midwife or nurse or doctor, you say you do this and you didn't do, please, it reduces their trust in you. Their trust in you. Beneficence, helping, and patient's interest first, not your interest. Put your culture aside, put your interest aside, and make sure patient's interest first. Be generous to them and do good to them. Justice, principle of being so fair to them and treating people equally. When the situation demands that you treat patient A before patient B, do that. Don't jump. Please, this will eliminate discrimination. Even the Constitution of the Republic of Ghana is against discrimination. Please. And then UN conventions, WHO, they are all against discriminations. So let's practice in that. Okay, ethics is about the conduct, stating the conduct and character. Now, the nurses, the midwives, the medical officers, all the health professionals, society expects much from us. Why? One of them is about our conduct and character. Society is aware that we've been trained to portray a certain character in the community, at the church, at the mosque, at the market, even in on the streets. So that is why society or someone will sue you, but will spare the driver who offended them, because they know that this professional should exhibit this character when this situation arises. That's why they question you. So are you a nurse? Are you a midwife? Are you a medical officer? Sometimes we give them that room because they have a certain marking scheme for us. Yes. Delegation. This is very important. Let's be careful with how we delegate. You transfer responsibility, but bear in mind that you'll be held accountable if the bad thing happens. Now, you ask patient to go and perform, you ask a colleague staff to perform a procedure on a patient on your behalf. You have just transferred your responsibility. But whatever happens to the patient, you will account for it. When you have this in mind, you will not always delegate a procedure that your junior colleague cannot do to them. If you have it in mind that at the end of the day, I'm the one going to the courtroom to be accountable and liable to whatever happens to the patient, you will not delegate someone with less experience to carry a procedure on your behalf or run a shift on your behalf. Yes. Negligence versus malpractice. Negligence simply means doing what you are not supposed to do or not doing what you are supposed to do. By then, for malpractice, if this thing happens to a professional, it becomes malpractice in our jurisdiction. In UK, that is the definition. So malpractice is doing what you are not supposed to do or not doing what you are supposed to do. That procedure, are you supposed to do that procedure as a nurse or midwife or a medical officer? Is this within your job description to perform this procedure? That day you answer it in court. Or you are supposed to do this and you didn't do. That is omission or commission. So when this thing happens and you are a professional like a nurse, a midwife, medical officer, a lawyer, becomes more practice. But if you are not a professional, it is negligence, simple. Now, defamation. Defamation simply means an injury to a person's character or reputation. Saying something that will cause more damage to the person's image, reducing the person's position, reducing the person's self-esteem, all those things. So when you do this by writing, we call it libel. When you do this by oral communication, we call it slander. So slander and libel are just under defamation. They are both under defamation. Now, when it comes to assault, assault simply means fear and imminent, apprehension to the patient. When you harm your patient through fear, panic, apprehension, that is an assault. Patients do not actually need to be aware of, or they need to be aware before an apprehension or an assault can occur. You can't tell me, you scared me, nurse, when I was sleeping. During sleep, you were not aware. During the when you were going through surgery with general anesthesia, you can't sue for assault. That is the difference. You cannot sue for assault during that, but you can sue for battery after when you are under anesthesia, influence of anesthesia. Please, let's get it. So in assault, you cause the person fear, panic, or apprehension. Simple. For instance, if you show a needle to a child, pediatric patient, that I will give you this injection if you don't take the drug, you have simply caused an assault to this innocent child by causing fear and panic. You can be sued, please. So anything you do that will cause apprehension to your patient, try as much as possible to avoid it. Now, the battery aspect of it, to physically harm your patient or touching patient without their consent, physically you have touched them. That is what I'm saying. For battery, this patient doesn't need to be aware before battery or such a thought can happen or occur. Because once I wake up from my anesthesia and I'm told you touch me this way, which were not supposed to be part of my procedure, you did this and that to me, I can now get up and sue you for that. Are we getting the difference? It should be clear. So for battery, example, patient is sleeping. Then you check vital signs. BP, pulse, you've checked them. How do you check the BP and pulse without touching this patient? You've touched them, fine. Okay, let's say you use manual method to touch. That is, you touch them and you had their blood pressure and pulse, temperature taken. Now this patient was asleep. They were not aware. But when they wake up, you can be sued for what? Battery, because I was not aware when you were touching me, when you were doing this. So I need not to be aware during the process, but even after. But in assault, you can sue or you can take action based on you being aware when that action was ongoing. Another thing we should be careful with when it comes to battery is during the process of attending to a patient in an emergency ward, you are looking for vein, IV line, and then you are dropping gloves on the patient, you are dropping syringe on the patient, you are dropping the tray on the patient because you want to save their lives. The patient is bleeding, you are trying all your best to save this patient. But those things you are dropping on the patient's abdomen or the chest, you are causing battery. Sometimes patient is rushed to the ward, and the way this patient has fracture in RTA, you have to remove the jeans or whatever the patient is wearing. The way you remove this cloth, if you tear them anyhow, you will save their life. By the end of the day, battery will occur. So battery is not only directly touching the patient, but the patient's clothing as well. Please, let's take note of that. Forced imprisonment. When you restrict the movement of this patient, it becomes forced imprisonment. For instance, you tell patient, if you don't do this, I will not open you to go out, or I will not allow you to go out of the ward. It means you have forced imprison them. Also, if you take the car key of the patient, that if you don't do this, I won't give your car key for you to go out with your car. You have forced imprison them. So let's take a caution when it comes to this. So criminal law is actually set of rules and regulations that are laid down to observe the character and conduct of people which are deemed to be harmful to the society. They are usually considered as a case between the individual and the state. So that is why your own child, if you kill your child, if you kill your wife, you kill your husband, your wife, your child, and underline the your. That is possessive to extent. Now, they are yours. But then the state will have interest in that. You cannot take away their life. So criminal cases, the state has interest in them. Then the civil law is part of the country's set of laws which is concerned with private affairs of citizens. So I bought a land from someone and then issues are happening. I drag the person to court. The state has no business in that. If you are owing me, I send you to court, or you send me to court. The state has no business in that. And then if a patient drags you to a hospital to court or a staff to court, that is a civil case. It's not a case between the patient and the state. But then be careful that a hospital case can turn around to become a criminal case. Please, some can become a criminal case. Imagine a patient slapping and killing a staff. This one becomes purely a criminal case. The state will have interest in that. Likewise, if the nurse directly kills a patient, it becomes a criminal case. So we should know this. That is where first felony will come in. If it is felony, first felony, second degree felony, or what we call the unintentional killing. In the legal parlance, manslaughter. Common laws are actually, derived from principles rather than rules and regulations. They are based on justice, reasons, common sense. Yeah. Administrative laws are enacted by means of rules and regulations with specific governing bodies charged with implementing them. So, example, you can have the Ministry of Health or the health sector. We have an act that is regulating this body. You can have the Nursing and Midwifery Council of Ghana. There is a whole act for that. We have Medical and Dental Council. There is a whole act for that. So that is important to note. Then constitutional law is a system of fundamental law or principles for governing a nation. So that is a constitutional law. Now, departments at risk in the hospital. We have the maternity unit or labor ward. This is because we are dealing with mostly more than one human being. We have children's ward or pediatric ward, the NICU. And then we have emergency ward, we have theater and others. Then the professionals that are at risk. We have nurses and midwives. They stay with patients for so many hours. They are in contact with them. So most of the orders too are carried out by them. And it's through these orders that the errors will occur. The omissions or the commissions will occur during that. So the doctor will give the prescription. The doctor will do the surgery. At the end of the day, you will be with the patient for long hours for monitoring and other interventions. Even the prescription that will be done, you are the last person to confirm and notify the pharmacist or the prescriber that, this, I need clarity before you can go ahead and give. Then physicians, they are the next. Dispensers and pharmacists. Also, those working at the laboratory and others, because Sometimes you end up hearing that the lab results was this or some. It can happen. Something can happen. So let's be vigilant. These are the professionals that are in direct contact with the patient. Yes, the first four, and then others will come in. Factors that motivate legal suits against hospitals and staff. The value for human life. We all know, even in the Constitution of the Republic of Ghana, you cannot take away someone's life. So life is precious before even money. That is why patients, when they are admitted, psychologically, they are disturbed. They don't think about what they have at the bank, but their life. So a least mistake, it's like you want me to die. So the value for human life is the reason. So errors, mostly errors are also factors that can lead to what? A legal battle. Because when I see that you committed an error on my child or myself or my relative, it will motivate me to do that. But without error, I didn't see anything. How? So poor relationship with patient and relative, the way we speak, our relationship. You will realize that most often when there are cases in the world, there is disagreement between a patient or patient relative and a staff. The nurse who has a good relationship, when they talk to them, they will listen. Some of them will even say, if not because of this nurse, like you see what I will do to you. Sometimes it takes one person from the hospital to intervene for a legal case to be removed from the court to be settled at home. It takes one person with good relationship for someone to stop legal action against the hospital. So let's have a good relationship with them. Okay, poor communication, patient right to information and education. Poor communication, this can be from a staff to a staff, or departmental, or from the patient to the staff, or from the staff to the patient. And then patients, their right to information, you don't communicate some of them to them. And then education, you do not properly educate them on their disease condition, on their medication. All these things are factors that can motivate legal action. Delay in service or more waiting time, it irritates patients. Some of them will attribute this to the death of the patient. Patient brought with asthmatic attack, and then they have realized that they sat down for more than 1 hour. They know that at least if salbutamol was initiated within maybe the first 10 minutes, if oxygen was set up, if this was set up, would have helped our patient. Patient in a crisis, sickle cell crisis. Imagine the patient waiting for 2 hours in crisis. They know that if this patient was attended to, oxygen set up, IV fluids were being given, pain therapy initiated, they know that this patient wouldn't have died. But waiting for 1 hour, 2 hours, it will motivate them to even go to the courtroom. Even if they will lose the case at the courtroom, there is no need. We should not allow room for even case to get to courtroom before we defend ourselves. And then discrimination, people are observing. It pains. At the end of the day, it will motivate them to go to court. Then the patient's right. The patient has the right to quality basic health care, irrespective of his or her geographical location. Patient is entitled to full information on his or her condition and its management and possible risk involved in except emergency situation when the patient is not able to make a decision and the need for treatment is urgent. Yes, the patient is entitled to know of alternative treatment and other healthcare providers within the service if this may contribute to improve outcome. So remember patient's autonomy and informed consent. The patient has the right to know the identity of his or her caregivers and other persons who may handle him or her, including students, trainees, and okay. So this is very important. Some staff, when the patient asks of their name, they even ask, why are you asking what do you want my name for? Some staff, when you are addressed by your name, oh Mr. Enoch, you feel offended that the patient is mentioning your name. Why should they know your name? Because you are scared that when you commit an error, your name will be mentioned by them. Probably that is why. Otherwise, you should be proud. If you think you are doing good to the patient, you want them to remember your name. So tell them your name. Don't hide the identity. If it is a student that is going to carry this procedure, they know that this student is learning. Would they allow the student to carry the procedure or not? So proper introduction is very necessary. The patient has the right to consent or decline to participate in a proposed research study involving him or her after the full explanation has been given. The patient may withdraw at any stage of the research project. Yes, very necessary. A patient who declines to participate or withdraw from a research project is entitled to most effective care available. Don't use this as a punishment, please. Patient has the right to privacy during consultation, examination, and treatment. In cases where it is necessary to use the patient or his or her case notes for teaching and conferences, consent of the patient must be sought. Please. If we don't do this, these are their rights. Patients are now aware of this in our societies. That is why they initiate lawsuits. Patient is entitled to confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party. You are the second party, they are the first party. So should not be disclosed to a third party. So even the husband or the wife, no, becomes a third party. Are we getting it? It's required by law or is in the public interest that this information can be leaked. Yes. The patient is entitled to all relevant information regarding policies and regulations of health facility that he or she attends. We should not deny them access to this information. Remember the RTI. Procedure for complaints, dispute, and conflict resolution should be explained to patients or their accredited representatives. Hospital charges, mode of payment, and forms of anticipated expenditure shall be explained to the patient prior to treatment. So before you started treating this patient or you admitted them, did you tell them the cost involved? Now they cannot pay at the end of the stay in the hospital. Now you are telling them you have to force imprison. If they don't pay, they are not going home. That is forced imprisonment because you didn't explain to them. If in any way during your proper assessment, socioeconomic status should have been considered. You should have referred them to social welfare. What was the intervention of social welfare? Such questions will be asked. Some patients are also admitted without their notice. Sometimes they come to the ward and tell the staff there that I'm told by the doctor to come here. Were you told you'll be admitted? They tell you no. Sometimes they come to the ward level, then they will tell you, I want to go and prepare because I didn't know the doctor admitted me. So some of these things, we have to take care of that. Exemption facilities, if any, shall be made known to the patient. The patient is entitled to personal safety and reasonable security of property within the confines of the institution. The patient has a right to a second medical opinion if he or she desires. Sometimes we don't even care that the patient can even decide which medical officer which nurse should attend to him or her. They have all these rights. Yes. Now, duty of care. This is where legal suits emanate. It's a legal responsibility imposed on an individual under tort law that requires them to follow a level of reasonable care when conducting any act that could harm others, or is legal obligation imposed on an organization or a profession requiring adherence to a standard of reasonable care while preventing any act that could foreseeably harm others. Foreseeably underline. It involves how one conducts self. When engaging in an activity, an individual is under a legal duty to act as ordinary, prudent, reasonable person will act given the same set of circumstances. The ordinary, prudent, reasonable person will take precautions against creating unreasonable risk of injury to others. So duty of care. You owe that duty of care to the patient. When patient enter the ward, don't sit down that they should walk to you before, or they should talk or greet you before you start taking care of them. Once they have entered the ward, duty of care starts. There was a case in the United States, which I will cite in my subsequent presentations. The ruling was that once the patient entered the ward and whatever that happened to the patient, all those on duty were responsible for it. But if the ward was closed and the patient was still outside, the nurses or the health professionals on duty wouldn't have been held responsible. Duty of care. You owe patient a duty of care once you are a health worker, a nurse, midwife, or medical officer there. It is this duty of care they are going to inspect during the court proceedings, please. So let's take note. So duty of care continue. Duty of care, that its own, has two distinct aspects. One, it must first be shown that duty was indeed owed the patient. That is what will be inspected at the court. Okay, if monitoring of the patient was the issue and the patient fell and had fracture and this case went to court, the court will first of all look at the duty of care. One, do I owe duty of care to this patient? That is by monitoring this patient. Monitoring this patient, giving this patient protection, assisting patient to move out of bed. If yes, it has been established, then we move to the second scope. The scope of the duty that must be proven. That is to say, the scope of the duty that must be delivered. So now, what is the scope of my duty? Usually, this is the most difficult one at the courtroom to prove. But breach of duty occurs at this second stage. Mostly, yes, it is I owe duty of care. But that duty of care is rendered during the scope. So if you breach it, then the court can proceed fairly. The nursing profession is among the few professions with international standards. So nurses and midwives, even medical officers, international standard. These standards are strictly implemented in all countries for quality healthcare delivery and are foundation for accreditations in most countries. The test for the court to apply is what a reasonable. So they are comparing you to a reasonable person, a prudent nurse with a like experience like you and with education like diploma or degree or certificate will do under such a circumstance. Okay, so breach of duty owed the patient. The breach of duty owed naturally follows as the second element of malpractice and negligence. This element involves showing deviation from the standard care owed the patient. Something was done that should not have been done, or nothing was done when it should have been done. Are you getting it? That is omission or commission. Omission or commission. Example, an incorrect medication was administered. That is commission. You have done something that is not supposed to be done, and that led to something else. A patient or a scheduled medication was omitted. You were supposed to give a patient a medication at a certain time, but you didn't do. That is omission. So omissions entails much potential liability as commission. They are all pepepe. They are all the same. What you fail to do or what you do when you are not supposed to do, they carry the same weight at the courtroom. Now, negligence versus malpractice. Like I explained earlier, when the act is involved, the act is conducted by a professional, it is malpractice. The other way is negligence. So negligence is a broader term. An example is a fall by an elderly person who is being cared for by a sitter. The reasonable person in the place of the sitter has a standard of care and the duty of care to prevent such a fall. Are we getting it? So in this case, that case is what we call negligence, because the person that is taking care of this aged is not a professional. But if the act is caused by a professional, that's malpractice. So malpractice continues. Now, element of malpractice. So when you go to the courtroom, these are some of the things that will happen. To be successful in either a malpractice or negligence cause of action in court, in most jurisdictions, the plaintiff or the injured party must prove the following elements to establish liability on the part of the defendants. 1. Duty owed the patient. The court will rely on your duty owed to the patient. That is, they will use your job description. Now, if really there is a duty for that, breach of the duty, whether you have breached that duty. So if you have breached the duty, the next question, foreseeability. Foreseeability is your ability to see something will happen if ABCD is done or if ABCD is not done. You should have vision ahead based on your expertise or knowledge. For instance, if patient comes with blood pressure, the systolic is 200, the diastolic is 160, and you know that a drug has been prescribed by the physician, let's say hydralazine has been prescribed, and you do not give this hydralazine as prescribed, something can happen to this patient, complication can happen. That is foreseeability. So you have to give. So your breach of duty is to give this drug. Did you foresee this? That if you don't give this drug, the patient can get intracranial hemorrhage or stroke? Did you foresee this? Or a patient whose blood pressure is below hypertensive emergency. If you fail to serve the drug, did you know that if you fail, or did you foresee that if you don't serve this drug, patient could progress to hypertensive emergency? These are the questions. Then the causation. If this patient actually ran into complications such as stroke, the causation, the court is going to establish that you failing to foresee or you breaching the duty cause the current injury, complication, or the death of the patient. If that one is established, what kind of injury is that? The injury that will be established at the end of the day, does the patient deserve damages? That is the fines that the patient awards or what should be rewarded to the patient. Then at the end of the day, you have lost the case at the courtroom. So the case of the late Helena versus the 37 Military Hospital, that is the family. The family initiated the legal suit against 37 Military Hospital in 2015 over the death of their 27-year-old PhD student. This occurred when she was due to deliver, opted for cesarean section, but was turned down by EMO. Remember, autonomy of the patient's right to determine what to be done, should be done on them. She had difficulty in delivery for several hours. Remember, foreseeability on the part of the midwives and physician. Baby delivered asphyxiated and sent to NICU, suffered disfigurement. She bled and later died, with evidence at court showing that blood secure for possible transfusion was not used. Foreseeability in mind again. At each point in time, whatever they failed to do, they should have foreseen that something will happen. The court based on this to award the family more than 1 million Ghana cedis. Duty of care by midwives and physicians established. Although the medical officer stated that the request for CS was too late, yet the court established that the request for C-section was made several hours before the death of the woman. Evidence of bleeding leading to death was also established. Evidence of complications suffered by the baby established. Duty of care breached by midwives and physicians. Are we getting it? But in the court ruling, actually, some of the blames were more apportioned to the physicians. Yes, I'm speaking on this case because it has been dealt with. Those pending at court, I cannot speak about them. I'm afraid I'm too young for contempt. So measures to avoid legal suits. Know and respect the rights of patient, the right to life, and then the value for human life. Duty of care and your scope of care. You have to know that. Treat every patient and relative as rich, educated, and as people who know you. As people, if you really think this patient and relatives know you, sometimes you behave differently. But if they don't know you, you treat them anyhow that they don't know you. So when they go, they will meet you anywhere. Please, also treat them as rich. The way you treat people, and you favor people because they are rich. When you consider everybody as rich, you treat them equally. Treat everybody as educated. You see people with PhD. PhD's families will sue more than people like my family without diploma. So treat everybody as educated. In any case, you don't even know whether this person on bed has PhD or not, or the person is a lawyer or even a medical doctor, you don't know, or a nurse, you don't know, or a midwife. So when you are doing wrong, they know. Please, reducing errors and professional handling, if any. Professionally handle the errors by communicating to them, be honest with them, handle it, report, don't hide things, please. Respond to patients and relatives' needs as soon as possible. Most often they will say, I call on the nurse or the midwife or the doctor, but they didn't mind me. It is not a good conversation. Proper communication, patient right to information and education. Try to reduce waiting time. You know waiting time, what it causes. Avoid discrimination, like we cited already. Documentation and proper communication among staff will reduce errors and also show that you have carried intervention when the need arises. Staff awareness and sensitization. Some hospitals still don't even talk about it. But one lawsuit will bring a whole hospital to it news. Yes, and people are hunting for legal cases in hospitals. If we don't know, let's take care. And then proper delegation. Know who to delegate to do this on your behalf. Because when it happens, you will be held accountable. And then see them as clients and customers and not patients. I'm saying this because if you go to bank or if you have a provision store and people come to buy from you, the way you treat them is different from someone that comes with illness. You treat people like they are patients. Patients are people. You treat them as if they are people that need to be favored by you, that need to be helped by you. No, you are helping yourself. You are working for your own good. They have employed you. So when you see them as people who come to buy things from your store, you see them as your customers, you will know how to handle them. In any case, patients are customers, but we have allowed a certain meaning to be labeled against patients, and we don't see them as clients or customers again. See how insurance agents are working in facilities and they are talking to people. They are looking for customers. But we see our customers as patients. Let's stop seeing them as patients and see them as clients and customers. Ladies and gentlemen, this is the end of the presentation. Subsequent presentations will be made. Thank you very much for your time and attention.